For Alberta's frontline healthcare workers, this is a repeat performance no one wanted. Overwhelmed and burned out by a COVID resurgence, many say could have been prevented. Earlier, I spoke with Dr. Yael Moussadji, an emergency physician, about what scares her and what gives her hope. What does it feel like for you now to walk into an ER, knowing all this is happening with the numbers going up and with the protests happening? What does that feel like?
We've been doing this now for 19 months. And we have worked collaboratively across specialties, across healthcare providers in ways that we never have before. We have done everything we can, and there's really nothing else we can do. What's really going to move the dial on this and what's going to move us forward as a society is making sure that everybody who can is vaccinated. And, there's certainly this moral burnout that we feel, this fatigue that we feel, knowing that people are choosing or deciding not to get vaccinated.
When you use the word burnout, you hear that across the country, but on a tangible daily basis, what does burnout look like in an emergency room?
Nurses are working short-shifted, and in some cases they're being mandated to work 4 hours beyond their 12-hour shift, even if that's been overnight. They're having vacation requests denied. They're completely overtaxed and overwhelmed, and it affects the entire team. And so that's really one feature of this burnout I see. And then the other, of course, is again this dilemma we find ourselves in, where we're providing the best care we can, we're doing everything we can, but there's really nothing else we can do. And it really is up to the public now.
Is betrayal too big a word to describe that feeling?
Not at all, absolutely. In fact, I would say that's been a pervasive sense among all of us who have been working at the front lines of this for so long, that we really do feel betrayed in a lot of ways.
By the public?
By the public. By those who have chosen to be unvaccinated. Certainly, there's a huge groundswell of public support that is still there, and people that have decided to get vaccinated, and so we appreciate everybody who's done that, but we need more.